And I've always had the philosophy you're either green and growing or ripe and rotting, you see. So we've tried to keep on the cutting edge of progress. New treatment, new procedures, new technology. The half-life of medical school today is 4 years, which means half of what they learned is out of date by the time they graduate. The problem is nobody tells them which half. The number one reason people see doctors in America are for neuromusculoskeletal problems. Back problems, headaches, neck, shoulder injuries, knee injuries, chronic pain syndromes. The one thing we specialize in. 390,000 people have back surgery every year and 95% is unnecessary. So the question is, the body's energy. Basically, there's 4 billion nerve impulses every second coming out of the brain, 4,600 miles of nerves firing 300 miles an hour. And you think about the energy, any blocked energy to any joint, be it from scar tissue or degenerative changes in a disease, if we can recharge those cells, it makes all the difference in the world. Jim spoke at a chiropractic conference, and I was intrigued by what he said. In fact, all the chiropractors got up and left, and I walked up afterwards and says, how does this actually work? I've got different modalities I've been using, from deep muscle stimulators and lasers and all kinds of things, and diathermy. He said, well, the difference is in frequency of energy. And he says, let me get your worst cases, because we see a lot of failed back surgeries. We see a lot of chronic pain patients that nobody's been able to help. And we use distraction instruments and a lot of different types of treatment. And he says, let me just demonstrate to you what we can do with these chronic pain patients. I said, well, you're on. Come on down. I said, I've got a bunch of them scheduled tomorrow. And so Jim came down and demonstrated, and 85% get immediate relief. How many modalities do you have that give immediate relief to a patient? And enhance healing 1,000%. So with people with pain that nobody's been able to help, we see cases like that. We had a gal recently that had 50,000 worth of tests at the local big hospital conglomerate here, and they couldn't help her. They sent her to Mayo Clinic for another 50,000 worth of tests, and they diagnosed this as urticarious vasculitis. They didn't know what caused it, gave her 23 different types of drugs, nothing helped. I said, well, why don't you let me see her? And her dad said, you think you can help her? She's 29 years old, disabled, in severe pain throughout her body. It's like on fire. So we did the pulse electromagnetic therapy on her brain. She came in every day for about a month and could not believe it. She cut her meds down 90%. She said, this is working, doc. I can't believe it. And just basically cells that aren't working in the body, every cell is a universe in itself. You stop and think the heart pumps 500 gallons of blood a day through 10,000 miles of capillaries, 66,000 miles of blood vessels, 4 times the circumference of the earth, carries food and oxygen to 75 trillion cells and takes away the garbage every 23 seconds. It's unfathomable, the energy within the human body, but it needs to be charged, it needs to be released. And that's what we as chiropractors do. So if there's a non-invasive modality that gets results, in this day and age where people are treating symptoms and we're a drug-infested society, 60 Minutes did a special, there's 260 million prescriptions for Oxycontin last year. 1 for every adult to take every day for a month. So the moral of the story is we're a drug culture today just treating symptoms. Now, one proven case of Oxycontin deficiency. I'll never forget when I got up in the morning and they said, if you're taking Vioxx, throw it in the garbage. Over 55,000 people died of taking Vioxx before the FDA took it off the market. They knew there'd be sacrificial lambs, but if there's big profits to be made and they can make billions, what's 1 billion in lawsuits? So if we can help people naturally, will they pay for 10 visits to go get pulse electromagnetic therapy to save a leg or to get rid of chronic pain? Absolutely. $370 for 10 visits or whatever you charge, it's worth everything like that. $500 that people will pay cash for, they'll gladly pay cash for itself. And I mean, 1 patient a day will pay for itself in about for the machine in a year, let alone if you see 4, 5, 6, 8, 10, and a lot more in referrals, people that come from all over, the referrals that you get, and you have to have a cash type of industry today, the way healthcare is going. So the key is to always be innovative. You have to invest your way out of any recession in life, and you have to always be seeking new ways to help your patients. They appreciate doctors who are innovative. This last year, I broke my shoulder playing racquetball. I play about 4 times a week, and I was running back, and somehow I tripped, and I hit the wall going full speed, and it knocked me out, hit my head against the cement wall, and broke 2 bones in my shoulder, and tore my rotary cuff and supraspinatus tendon. Broke the acromion bone and the Vulcan fracture to the deltoid. And in 3 weeks, I had all normal range of motion. I couldn't move my shoulder any direction more than a millimeter when I first started. And the Mayo Clinic said, we don't see breaks like this very often. But I'd come in every day, did the pulse magnetic treatment. It really enhances healing. So if people have had a knee operation, a new knee, if they've had back surgery, if they've had a shoulder replacement, now they're a patient of yours. If they want to heal 10 times faster, come in and get the pulse magnetic treatment. Even on the chronic cases that have went the medical route, you have something to offer. And what's it going to save them in medication to try to control pain, which every anti-inflammatory destroys your stomach, liver, and kidneys. They all cause a heart attack. Ibuprofen is the #1 cause of kidney transplant and kidney dialysis in America today. People live on it like candy. And 90% of the commercial, they say, take Solyndra if you've got pain. Well, 90% of the commercial is disclaimers, and half of them are lethal. So if you have constant thoughts of suicide, talk to your doctor before you jump off the bridge. So what good does it do to say, I feel better, but I keep wanting to kill myself? You know, that's not approach to health, see. And where doctors are kicking people out quicker and sicker, they refer for surgery today because that's where the big bucks are, and especially orthopedic surgery, open heart surgery. If we have something that'll dilate the capillary action to the nerve to get rid of pain, and dilate the circulation, get oxygen to the tissue. You think about the mitochondria in a cell. If you have a modality that stimulates mitochondria, which is the powerhouse in every cell, manufacturing ATP for energy, cell metabolism, protein synthesis. When you think there's 75 trillion cells, and every cell has 1 million polypeptides, with 75 trillion cells, we can't even fathom the energy potential the human body has. The key is to have some type of a frequency that the cells will absorb. And that's what this does better than anything, is in a natural way. It's been around since 2200 BC, magnetic energy. We talk about people even with magnetic personalities. That means you got a law of attraction. And when you got magnetic energy that charges cells that are weak and tired and no oxygen, and nerves are starved of energy. Every cell in our body has a positive and negative charge. When we walk, our arms swing opposite our legs. We can't walk the other way. If I move, a simple experiment at home anybody could do is move your right hand clockwise real fast and try to move your right foot counterclockwise at the same time. Can't do it. It's all electromagnetic field. The sun revolves around the earth through an electromagnetic field. Every cell has a positive negative charge where potassium sodium chloride gets exchanged in the cell membrane. So that energy just needs to be charged up, like charging a battery. This jump starts those cells that are blocked and that aren't getting the energy they need. In my opinion, PEMF belongs in every practice of any doctor who wants to be innovative, on the cutting edge, who wants to give superior care, the best care possible to every patient they see.